Dr. Ruth Ruckus is in the house. She is from MD Anderson and UTMB. She works on the platform of cancer prevention and education. She's doing some incredible work in regarding emerging cancer prevention, early detection projects aimed at population impact. She's the director of the Be Well Communities, a truly unique collaborative. I'd like to welcome Dr. Ruth Ruckus to the stage as one of our panelists. Also, John Perry from Kelsey-Seybold. He is their senior writer and broadcast producer. He has been doing a radio campaign with Spanish language with Univision in collaboration for over 10 years and has received over 35 awards, some of them for the work that he's done with Univision in regards to reaching the Hispanic community in language. John Perry, can you please join us as well? We also have Brian Sasser. He is the Director of Communications from Episcopal Health Foundation. And they are doing some incredible work as well that we want to highlight. EHF is committed to transforming the health of our communities by going beyond just the doctor's office, by providing millions of dollars in grants, working with congregations, community partners, and providing important research supporting solutions that address the underlying causes of poor health. And he will be talking to us about the initiatives and collaborations that they're undergoing there as well. If you could please join us, Brian Sasser. Finally, we have Kevin Nix. He is from Legacy Community Health Services. Kevin is Legacy's Senior Director of Communications and Public Affairs. He handles both the communications and public policy piece of this organization. And this year's been quite busy for them, both at state and federal levels. Legacy is the largest community health center in Southeast Texas, with 29 clinics serving Houston, Baytown, Beaumont, and Deer Park, including their innovative solutions in regards to school-based clinics at Yes Prep and KIPP charter schools. They've currently served 150,000 community members last year for patient services. The vast majority were patients that didn't have access to health care. And I'd like to welcome Kevin to the stage to show and highlight some of the work that they're doing as well. These folks were handpicked to share what they've done and what they're doing, because I think that it's important to highlight how unique they're moving forward in regards to this Hispanic health conversation. So if each of you could just take a moment to kind of talk about your role and what you're seeing as like the new narrative, what's kind of unveiling and developing in regards to Hispanic health here in Houston, and how your organizations are meeting those needs in unique ways. And then after, each of you has an index card. After each of them go through that, I'd like for you to start thinking about questions that you'd like to ask them upon hearing what their roles entail and what their organizational missions are as well.
Am I on? I guess so. I'm Ruth Ruckus. I'm part of the Cancer Prevention and Control platform at MD Anderson. We work closely with the Moonshot program, and our goal on the platform is really to take all of the amazing science and evidence-based practices and the things that MD Anderson knows about cancer prevention and control and deliver it to the world. So whether that be through policy change or through professional education or through community resident-driven engagement, that's the role of the platform. And I oversee a program called Be Well Communities, and our mission is to promote wellness and to stop cancer before it starts. We do that in a number of different communities across Harris County. We have plans to hopefully do it in many more places, but I'll talk specifically about one initiative that's in Baytown, Texas, that's funded by ExxonMobil. They gave MD Anderson a gift of $10 million to develop a Healthy Communities initiative in Baytown. There was a process we used for assessing communities and determining where to go, but I've been at MD Anderson for about a year and 4 months now. Previous to this, I was at the Livestrong Foundation, where I worked with hundreds of communities in a number of different ways. And in Baytown, we have a group of about 20 different engaged individuals who represent the school district, they represent the city, they represent the nonprofits, they represent other health agencies. Legacy is a great member of our work as well. And we went to the community and we said, we want to understand what you need and how we can address cancer prevention and control in this community. What do you think would work? How can we invest this gift in you and provide technical assistance and capacity building and funding and support and bring evidence-based programs into this community in a way that can have change for everyone. And so we've been developing that program over the last year or so. We have 5 areas that we focus on: diet, physical activity, preventive care, so HPV vaccination, mammography, colorectal cancer screening, those types of things, UV radiation exposure, and I forget which word I went in now. Diet, physical activity, UV radiation exposure, preventive care, and tobacco use. So sorry about that. So we're really focused, we asked the community where they wanted to focus first, and they selected diet and physical activity. So that's where we've been focusing. I won't go through everything that we're delivering there, but just to give you a couple of examples, we work really closely with the YMCA on delivering programs after school for students that are getting them physically active. We're delivering the diabetes prevention program through that partnership for employees of the school district. We have walking clubs for anyone in the community that wants to get engaged and involved. We have another program that delivers free fresh produce. We have another program with the schools delivering an evidence-based, research-driven program that helps to address childhood obesity. So I think the unique thing that we're seeing within this community is really taking these best practices and what's been learned and engaging the community in a way that works for them to really deliver on the promise of cancer prevention and control within the community. And we are only able to do that because of the partnerships and the amazing people who live and work in Baytown, Texas, and are willing to participate in this project with us.
I'm Brian Sasser with the Episcopal Health Foundation. We were created when the Episcopal Diocese of Texas sold St. Luke's Episcopal Health System and took $1.2 billion from the proceeds of that sale and created this foundation. And when we talk about how we support solutions that go beyond the exam room and address the root causes of poor health, what does that mean? One example that I use a lot is a young man named Angel who kept coming back to the clinic, the children's clinic at Northwest Assistance Ministries in Northwest Harris County with asthma. Keeps coming back, time after time, severe cases of asthma, and at one point even had to go to the ER because it was so bad. So if we just keep treating him at the ER and treating him at the doctor's office, nothing changes for Angel. He just keeps having the same symptoms, and we treat the symptoms and we go on. And we could build more clinics, more asthma treatment centers, and the same cycle continues. But what they found out was, let's go into his apartment near Greenspoint Mall and see what's causing his asthma. And so we funded a program for Northwest Assistance Ministries to take a group of home visits, a group of inspectors to go to his house, found out that he had a very old mattress, terrible carpet, mold in the air ducts. And if you solve those problems there, you get the root cause of his problems, that's one less thing he has to worry about, and maybe that changes his asthma. And not only is that less expensive for the healthcare system as a whole, in entirety, it's also better for that individual patient. So we're looking for those solutions. We also do a lot of work in providing access to care, funding community clinics across the area that are providing access to care. And a lot of research that we do is centered around not only access to care issues like the Affordable Care Act and the uninsured in Texas, we cover 57 counties. So our foundation, while based in Houston, covers all the way East Texas up to Tyler, over to Austin, Waco, Matagorda, and back to Houston, and then all of East Texas. And so the needs for those different communities are very different. We do a lot of rural health research too. But I think the important thing that we're trying to do is go beyond just funding more clinics to serve more people with more procedures and try to find those solutions that address the underlying causes of what's causing people to have poor health.
So I'm Kevin Nix. I think there are two, if you will, narratives that have been around forever, actually, for a long time. But one, I think there may be supercharged now and then in the future. One is cost and access of care. And so at Legacy, we're a federally qualified health center, which means we are on a sliding scale. That's how patients pay. And we really keep folks out of the emergency room, which is where it's so costly, right, for things like asthma, earache, and a cold. So I think cost, especially in Houston, especially around the country, especially with ACA is up in the air, is going to be a big, even bigger deal than it has. And we are all about keeping costs low and quality of care high. The other big narrative, I think, is about what everyone else has discussed, diversity. And part of Legacy's brand is diversity. It was founded on diversity in the 1980s, essentially. And so, we are a judgment-free zone. We see anybody that walks through our doors. We put a lot of emphasis on the Hispanic community in Southwest Houston, both in our patient communications, but also the culture. It's not just communicating in a bilingual way. It's about it's really putting the right staff people in the clinics that know the culture, not just the language. I think that provides better care. So I think that we try to reflect the diversity of Houston wherever we are, and that's going to be the biggest charge for us moving forward. I think that we're doing a lot for the Hispanic community. We're not doing nearly enough. My charge to this room and across the city is I think everyone needs to step up in a bigger way to really focus on the diversity on the Hispanic community, not just language, but in culture and in the social determinants of health that Brian talked about.
Hi, everyone. I'm John Perry from Kelsey-Seybold Clinic. We have 20 multi-specialty clinics throughout the greater Houston area. Go as far north as Spring and Humble and the Woodlands, as far south as Richmond, Sienna Plantation, Fort Bend, Sugar Land. What we are doing right now, where I'm involved, is called the Medical Minute. Maybe you've heard it on the radio. It's actually a misnomer because it's 90 seconds in English language. It is 60 seconds in Spanish. And we began the Medical Minute with a philosophy of bringing in active practicing physicians to record our commercials in written, has a dialogue between the voice talent at the radio station. Here it's the wonderful Renzo Heredia, who's our front person and just does a wonderful job. We have our physicians come in. They have a conversation with Renzo, which of course is rehearsed and recorded, and then sent out. We try to address topics that resonate most with Hispanic community. That is health issues that may affect the Hispanic community in a disproportionate way. For instance, there's a disproportionate amount of type 2 diabetes. There's cardiovascular issues. There's sadly an epidemic of obesity. What we do is choose the topics and the physicians practicing in that area to come in and address that so it'll resonate most with the listeners. When we began, the first thing we did, we were already on English language at the time and had been for several years. We decided, let's reach out. Let's reach out to the Hispanic community. The issues that are important to them, the ones I mentioned, the health issues, but also the importance of just choosing a primary care physician, having regular health screenings, developing a relationship with the doctor, and letting them know that we have bilingual physicians in any specialty, every specialty. Family medicine, internal medicine, gastroenterology, endocrinology, which of course deals a lot with the diabetes. So when we began, first thing that happened, Renzo, bless him, came over to the main campus and toured it. He wanted to meet people. He wanted to see. He says, if I'm going to promote this and help, I got to see what's going on here. He liked what he saw. In fact, he ended up getting a Kelsey-Seybold physician who we'd done commercials with. And at one point, we were doing a 30-minute live call-in section where the listeners could call in and on air live ask the physician questions about healthcare. And I think that went over pretty well with the community. But here's something I want to address. When we first began, it started as a 6-month pilot program where we were on 2 weeks out of the month. And at first, and this is what I want to emphasize, we weren't getting a lot of feedback. And I thought, well, let's stay with it and see what happens. So we did it another 6 months, 2 weeks a month. Still minimum feedback. But it was on the third attempt it broke through. And now we have increased our Hispanic population that's coming into our physicians by a whopping 13%. Well, that's a lot. And we're getting great feedback in the Woodlands community. Our co-managing physician there is Dr. Leonardo Espedia, who is bilingual, and he's doing a great job, and he's done commercials for us. He's done live call-ins with us, and it's really getting the Hispanic population to know about Kelsey-Seybold, to come in, get preventative health care, get regular screenings, choose a primary care physician. We want them to come in and see the physicians before they get sick. When the doctors have more options, more treatment options with better, more positive patient outcomes from those options. We did some television too. You know, in February 2016, we had a 2-month run with one of our Hispanic doctors down in Cinco Ranch. They came in and did a nice spot with Renzo that ran for a while, and we're just getting great cooperation from everyone here at Univision. Alberto, our sound engineer, who's given us a sonic cue every time our commercial comes on. We've got this percussion sound that comes on, and Renzo's wonderful. Our doctors are wonderful. But here's my takeaway message: stay with it. It's got to penetrate the community. It's not immediate. Stay with it, because it was on that third run that we were getting our feedback. Now they're coming in. So it's really worth it. That's it.
Thank you so much, each of you, for sharing what you do, how you're impacting our city and the health of our people. I think it's nothing short of heroic, the collaboration, the power of the synergy. I mean, as I hear their stories of their work, they're collaborating with YMCA. I know Legacy, personally, I used to work at Legacy, so I know that Legacy is still collaborating with the Houston Food Bank, because that's a program that I initiated there that I'm very proud of, because you cannot be well if you're not eating well, right? And that's an issue. We have food deserts. So, you know, those things, collaborating with the YMCA, with Legacy, with the food bank, those things are critical. And I think as we move forward, if there's anything that we've learned, in spite of everything happening in the world, that we are stronger together, and we cannot do this work in silos. And if one of the lessons that I took away from being in healthcare is that we tend to be a siloed institution sometimes, and we tend to stay in our lanes. And it's at the stake of the community, right? So I applaud your collaborative, unique efforts. I think it's incredible, and I think that it's going to be one of the primary waves that we actually move the needle forward and stop talking about changing health and actually start living and breathing as change agents in that space. So I want to honor that and thank you and applaud each of you for the work that you're doing. John Perry, I really appreciate your kind of sharing the longevity of our business relationship and the impact that it's had on your revenue generation, new patient acquisition. I think it's key. And I really love what John said. He's like, stay with it. He's like, what didn't happen the first run, second run, but the third one, we're seeing a 13% increase, right? I think that's something that I'd like for you all to walk away with here. We are engaging more and more hospitals and health organizations in Houston, and there is a fear. I mean, and the fear is it's valid. How do we jump into that space? Because when we think of Hispanic health, people tend to cringe a little bit, because I think we've lived so long in the narrative of the 80s and 90s that Hispanics only flood our ERs. That is no longer the reality of our situation. The health space is so incredibly convoluted and so difficult and layered, right? For us, even as educated folk, to understand and wrap our brains around. But one thing that I think that we need to all focus on is the fact that the Hispanic community in Houston is not a monolith. While the disparity is great, the data is there, and we can't deny that. there is also another side of the story, that there is a population that when you lean into them and you speak in language and culture, they will be your loyal patient for life. We are a generation of loyalists. So I'll give you an example. My mother actually worked at Kelsey-Seybold, and because my mother worked there for so many years, that was the place that we went, that we still go to. We take our children there now. So it is something to consider when leaning into the Hispanic community. Those two things, right? This conversation is dual in nature, and that we've got to address the prevention, education, and the wellness of our Hispanics in Houston, because there's an epidemic upon us. But the other side of that is that there is also a thriving, educated community within them as well, that are going to be change makers, that are going to end up being leaders within the Texas Medical Center, I hope sooner than later. So keep in mind that there is a duality in this conversation. I want to open it up to the audience and ask if you all have any questions. We have some folks that are coming down the aisles to take your note cards. If anyone has a question for our panelists, now is a great time. It's not every day that you get 4 rock star organizations in a room to talk about what they've done to impact health in very powerful ways. So anyone have any questions? We'll open up the floor to you all. Great. Question for Dr. Ruth Ruckus and for Brian Sasser and John Perry. In your quest to reach populations that are vulnerable with a variety of health issues, are you integrating community health workers? This is the leader in the nation for being the largest community health worker network. Texas is the leader.
Yes. I absolutely agree and think it's a really critical part of the work to be done. So completely support that, and think that that's one of the definite assets that we need, is to have community health workers as a part of this effort that we have going, and making sure that we're accessing people where they live, and that we're getting to people sort of where they want to be approached, and making sure health is a part of every day. So that they can, that it's not an emergency visit, that is really something people are thinking about on a regular basis. We'll have a health communication campaign as part of our project, as we really believe that, education and information and having points of decision prompts and those kinds of things are critical. And we know that people on the ground as resources will be absolutely necessary to ensure people are navigated to the right places as well. So absolutely agree that's an important part of any approach in the community.
And we recently funded a community health worker project in Waco. And the key point about that is that it's from a group called Prosper Waco, which is a community impact group in Waco. But the key part that they're doing, they're listening to the people who they're serving. And they're the ones who said, we need these workers, we need help navigating the system, we need help with prevention efforts and those kind of things. And so that's an important part about all this stuff, is not just dictating what you think they need in whatever neighborhood you might be in, but listening to the folks there. And community health workers was one of the stuff that we've heard and ended up funding because of that.
Yes, we have. We've had physicians hold what is essentially a town hall meeting, actually at the community's clinic. They've been very successful in Katy, Cinco Ranch, and the Woodlands. We've also had physicians go to schools to do a Q&A section at night. And we've also done things with the zoo and with the YMCA. Well, especially we do something with our pediatricians where the children can come in, and we have a mascot called Kelsey Bear, which is actually just one of our large people hiding in a bear costume. My understanding, it's very hot in there. I'm glad it's not me. And they meet the kids and bounce around. They take photos, and they will let the kids, will take their height and their weight and let them, ask questions and kind of try to have fun. And that's resonated pretty well. We've held those at different clinics, the big one being at main campus and at the Weekly Family YMCA on Stella Link.
Wonderful. There's one more question. Question for John Perry in the Medical Minute. Have you ever covered the topic of the importance of diversity participation in clinical research, especially research regarding something and cardiovascular disease. Can't read that.
I don't know about the research aspect, but we've definitely covered cardiovascular disease and all its facets. We've had physicians come on and do medical minutes about hypertension, cholesterol levels, stroke, heart attack, and the risk factors involved with that, and the lifestyle modifications people can make to reduce that. As far as out-and-out research, I probably haven't addressed that in the medical minute, no.
So one thing I'd like to add to the conversation, because the topic of clinical research came up, I think that is an area that we can do better in as well moving forward. Clinical trials, often Hispanics are not represented within them. So any thoughts on that, Episcopal Health, Legacy, or MD Anderson? And with that, we will wrap up and we'll move on to the next.
We really don't do clinical research in ours, but back in my old life as an investigative producer at Channel 2, and we did a lot of about the disparity, and it was back 5-6 years super high. I mean, it was almost 80% white on all the clinical trials that we did, and it is a big issue for sure.
MD Anderson does have programs that address that topic. It's not a program that I work on, but I know that certainly is important to MD Anderson, who does clinical trials, to really try and ensure we have diversity within those trials, and to provide education within communities to help people understand what trials are, how to get on trials, and really how to access those things. One thing we're helpful with the community-based work that I lead is that we'll create really sort of ready, open communities to the topic of clinical research, going into a community and saying, hey, get on this trial, probably isn't really a great strategy. But if you're in a community and you're explaining the topic of health and wellness, and then you can bridge the topic to clinical research, I think that's a good opportunity as well. So completely agree. It's a problem, and it's an area that should be addressed. And I'm glad to know that my colleagues do work on that issue as well.
Thank you. So I just received about 4 or 5 incredible questions that we're not going to get to, but here's what I'd like to do. If you did ask a question, you didn't put your name on it, can you please see me? Because I'd like to get your questions answered and connect you to these folks. I think that's incredibly important as we continue our conversations moving forward. Because we're a little behind on the agenda, we're going to have to go ahead and wrap up the panel. So thank you to each of you for sharing, for coming here. I hope that some of you were inspired to connect with them, to do some incredible work, that would engage the local media and find favor in our platforms here as you move forward to build a stronger Houston. Thank you so much, you all. So we realized that it was very important to highlight health organizations that are currently engaging the Hispanic community in language and in culture. And when we did this, it was quite easy because there are 2 powerhouses that are doing this, that have not shied away from opening their doors and their marketing communications dollars toward this community.